The psychological approaches, they will have to be adopted and they will have to be carried out and continued until the therapies release the child or the teenager from the treatment. So they are, like for most of the children, the cornerstone, the basics of the treatment. But some of these children and teenagers, they are so dysregulated that they cannot comply with the treatment. So that the therapies cannot get to them, cannot interact, cannot promote results, because some children seem to be completely disconnected, as they are in their own world. They are not interacting with the environment. Sometimes they are more aggressive, they are more restless. And for these particular complaints, irritability, aggressive behavior, being like connected, I have had better results with CBD than with traditional typical drugs. And sometimes the results are so impressive and they're so fast. That's why people sometimes call it miraculous. But unfortunately, it doesn't happen for all the patients. The answer is clear. It's a spectrum. It's a spectrum disorder. So we have from one end to the other end. Maybe we are treating symptoms. I don't know if we are treating the core causes, the root causes, because it's a different population. So many genes involved, more than 168, 170 genes already confirmed to be involved. So it's always a different profile, but we have similar symptoms and we have similar conditions. For some of these patients, because I contact families very often, so we interact through WhatsApp and those similar apps. And also, I always ask them to report 5 days after initial use, then 10 days, 20 days, depending on the case. So we have very nice interactions. And sometimes the first report, 5 days, 7 days, it's really impressive for families sending like videos of their beloved child doing things that have never done before, being more attentive, and sometimes even promoting communication. I think that as the child regulates, becomes more with the environment, more connected to people, not to things, the families can report those unbelievable progress sometimes. But unfortunately, remember, doesn't work like that for everyone. But at the end of the day, even for those that don't have impressive results, we don't have bad side effects. I never had really to, I don't know if it's the topic now, but to stop cannabidiol from a patient because of serious side effects, not psychological and not also like organic or gastrointestinal. I know it's a common complaint, but we never have to stop, and I never had any major alterations in hepatic enzymes and things like that in the blood profile. The second, sometimes they don't respond really well, right? I have a patient now, she's 8 years old. She's very, very aggressive, not only physically, but verbally. When she's in the office at the reception, if an adult passes or a child, she'll try to reach and slap or kick or offend. And she has been taking antipsychotics, antidepressants, and anti-epileptic drugs, trying to modulate her behavior. We started with CBD. Now she's on 300 milligrams per day, and it seems just like water, no response at all. Right? Now, for children that have an inflammatory background and children with GI issues, which in my practice and also in the literature are the most common comorbidities, it seems that it responds better. I haven't defined it about that. I have to gather more data from the patients, from my records, but they seem to respond better, especially when they have those GI issues, esophagitis and gastritis, sometimes even eosinophilic esophagitis, which is a complicated condition that now we see more and more often than we used to see in the past. So these will be the better respondents for me.